How to solve questions about pH abnormalities. They are important for part 2 and also for part 1 MRCOG. Okay, and when you look at the question of pH abnormality, we can get to the answer with two methods. Clinically, from the history, for example, if the patient has DKA, diabetic ketoacidosis, what will be the pH abnormality here? Metabolic acidosis. Metabolic acidosis. Okay, what if a patient has head trauma and problem in the respiratory center? There will be respiratory acidosis because carbon dioxide will accumulate. There is no good breathing, so the patient cannot wash carbon dioxide. Okay. And also we can solve using the coming steps. Okay, what is the normal pH? 7.35 to 7.45. In pH problems, we will be talking mainly about carbon dioxide and bicarb. Carbon dioxide is a gas. In the same time, it's an acid. Bicarb is a metabolic product. In the same time, it's alkaline. Okay, if carbon dioxide increased in the body, what will happen? Gas, so important for respiratory problems. If carbon dioxide accumulated in the body, what will happen? Respiratory acidosis. Okay, what if a patient did excessive frequent breathing? So did washing to carbon dioxide, what will happen? Respiratory alkalosis. Why? Removed carbon dioxide from the body with repeated frequent breathing. Carbon dioxide is removed. Okay. What about if bicarb accumulated in the body? What will happen? Metabolic alkalosis. Okay, what if the kidney removed much bicarb from the body? What will happen? Metabolic acidosis. Clear now? So, carbon dioxide will lead to respiratory problem. Bicarb will lead to metabolic problem. Remember, carbon dioxide is an acid. Bicarb is an alkaline material. So, at first, I will look at pH level, which is 7.35 to 7.45. Okay, if this level is present, I have two things. Number one, it can be normal, or there can be compensated problem. What is the meaning of compensated problem? There was acidosis and the body did correction by increasing the metabolic products. So it looks to be normal, but it's not normal actually. Okay, there is war, but there is some stopping to the war now. There is some equilibrium. Okay, like toxin and antitoxin. There is equilibrium, but is it safe situation? No, there is a problem, but the body is trying to solve it. What do you mean, doctor? Normal pH can be because everything is normal, or can be because of there is compensated acidosis or compensated alkalosis. Am I clear? Okay. Okay, so if pH is normal, please look at carbon dioxide and bicarb to see if they are normal levels. Okay, everything is fine. What if you find there is problem in their numbers? So there is a problem which is compensated. That's why pH level is normal. Because our body tries to correct small problems. And if the body could correct this problem, it will be a compensated situation. If the body could not compensate, the problem will be evident. Okay, so first thing, I will look at pH level. Normally 7.35 to 7.45. Okay, if the level is normal, okay, it can be because it's normal pH already, or there is compensated problem. Okay, what if pH is increased? So what is the problem? Increased pH, it means alkalosis. What if pH is low? So there is acidosis. Okay, then I will look at pH and look at carbon dioxide and bicarb to know if the problem is metabolic or respiratory. So first part of the answer, to look at the pH, to know is it normal, or there is alkalosis, or there is acidosis. Second part of the answer, to look at carbon dioxide and bicarb to know if the problem is respiratory or metabolic. Okay, so what are the normal levels of carbon dioxide and bicarb? Carbon dioxide, okay, either we can say it's 35 to 45, very easy numbers, 35, 45, or by its pressure, 4 to 4.6, Papa, which is a pressure unit, 4 to 4.6 points. Okay, if carbon dioxide increased, it will lead to respiratory acidosis. If decreased, respiratory alkalosis. Okay, what about bicarb? Bicarb, its level is 22 to 26. So to make it easy, carbon dioxide, number 2, I am duplicating the numbers from pH. 2, duplicating the number from pH. Okay, what about bicarb after 3 years? Okay, HCO3 after 3 years. So assume we are in 2023, it's 20. Okay, so it's 2 to 26. So number 3, number 2 is repeated 3 times. 2 to 6. 2 to 6. So from 22 to 26. So carbon dioxide duplicate the numbers from the pH, and bicarb you have number 3, so 2 to repeated 3 times and 6. Okay, if bicarb increased, metabolic alkalosis. If bicarb decreased, metabolic acidosis. Okay, there is another evidence which can tell you that there is metabolic problem. It's called base deficit or base excess. Base deficit or base excess. Its normal level from -2 to +2. What does it mean? -2, -1, 0, +1, +2, all of them are normal. Okay, if it's a +3 and higher, so there is metabolic problem. Metabolic what? Metabolic alkalosis. What if it's -3 or less? There is metabolic acidosis. So it's similar to pH, increase with alkalosis, decrease with acidosis, but they are specific to metabolic problems. Okay, let's now start solving examples. I am waiting your answers on the chat. First question. A patient has pH. Okay, I will give you here the numbers on the right, so it can be always be with you. pH normally 7.35 to 7.45. Duplicate the numbers to carbon dioxide, so from 35 to 45. and bicarb 2, 2, 2, 6. And also for carbon dioxide, using the pressure from 4.6 to 6. Okay. So if I say my question pH is 7.25. So now you reach it to the first half of the answer. What is the first half of the answer? That there is acidosis. Perfect. So far, there is acidosis. So what is remaining? We need to search for the criminal who caused this acidosis. Okay, I will continue my question. Carbon dioxide level is 50 and bicarb level is 24. It's respiratory or metabolic. Respiratory. Why? Carbon dioxide increased. And increased the carbon dioxide can lead to acidosis. So it's clear to be respiratory acidosis. Okay. Clear question number 1? I will do modification. Okay. The same numbers, but I will change bicarb level. I made here carbon dioxide increased to make it respiratory acidosis. I will make bicarb level also increased, so 28. What is your diagnosis now? Okay, look at my answer. Number 1, we have acidosis. We agree upon this. We have acidosis. Okay, excess carbon dioxide, excess bicarb. Which one of them can lead to acidosis? Excess carbon dioxide. So this is a criminal. You notice that excess bicarb should lead to alkalosis. So it's not the one responsible for the problem. So here the problem is respiratory acidosis. But why bicarb is increased? It's normally up to 26. It's increased because the body found that there is excess acidic material in the body. So the body was trying to do neutralization by increasing the alkaline materials. Okay, this trial so far was successful? No, it was not successful. Still, there is acidosis. So it's a respiratory acidosis with a trial to compensate. With a trial to compensate from the body. But still there is acidosis. Clear? So the body tried to compensate, but so far couldn't. But who knows, maybe already pH was 7.15 and the body could increase it to 7.25, okay? So here we have a trial to compensate. So this scenario now is respiratory acidosis with ongoing, I like this word, compensation. Clear one? Clear one? Okay, question number 3, I will modify in the same question. I will make bicarb level I will make it 20. So carbon dioxide increased and the bicarb decreased. Which one of them caused this acidosis? The answer, mixed. Why mixed? Excess carbon dioxide will lead to acidosis? Yes. Decreased bicarb can lead to acidosis? Yes. Both of them can lead to acidosis. So this is mixed acidosis. Mixed acidosis. Clear? Both of them are considered criminals. So it's a mixed acidosis. This is the final diagnosis. Mixed respiratory and metabolic acidosis. Okay? Got it. Okay. So number one, look at the pH. Number two, look at carbon dioxide and bicarb. Okay. What if I will change again the numbers to make a new question? So, pH 7.30. What is this? 7.40. So what is this? Normal. Okay. Carbon dioxide 50 and bicarb 28. What is this? Excess carbon dioxide should lead to acidosis. Excess bicarb should lead to alkalosis. So one causing acidosis, one causing acidosis, so we reach it to normal pH. So we have a problem compensated with the other one. Okay, doctor, which one is the cause and which one is the compensation? According to the scenario. If the scenario that the patient has DKA, so the problem is metabolic and the compensation is the respiratory. Okay, if the problem was trauma to respiratory center or something affecting respiratory muscle, so the problem is respiratory and compensated with the metabolic one. Okay? Clear? Okay. What happens during normal pregnancy? You will find the pregnant women telling you, doctor, I take deep breaths and I think I have dyspnea, I have frequent deep breathing. With this deep breathing, what they do? They do carbon dioxide wash. So carbon dioxide will decrease. Decreased carbon dioxide will lead to respiratory alkalosis. This is a normal pregnancy. Okay, doctor, what will be the pH level? If we say normal level 7.35 to 7.45, you will find the pH will be towards 45. You will find it 7.42, 43, 44, 45 even. Okay, not a must to be evident, to be more than 7.45, no. Okay, because they don't have pH abnormality. Okay, it's just a pregnancy effect. So pregnancy itself is a respiratory alkalosis condition. Okay, you will find pH towards 7.45 and you will find carbon dioxide level low. Clear? Okay. Okay. How to differentiate between mixed and compensatory? In mixed, you will find the respiratory and the metabolic problem causing the same problem. I mean, both of them can cause acidosis or both of them can cause alkalosis. So how many criminals? 2. While in compensatory, you will find one of them can cause acidosis and the other can cause alkalosis. That's why it's compensated. Okay, and if I do it like this one mixed, while this one compensated. Am I clear? And of course we can do like this one, and this one also, it's mixed. Okay. We will come to this deficit and the base excess now. Don't worry, we'll take a break just after 10 minutes. Okay. So the last thing we said, if the two problems causing acidosis, it's mixed acidosis. If the two problems causing alkalosis, it's mixed alkalosis. Okay, if one problem can cause acidosis and the other can cause alkalosis, so one leading to the right, one leading to the left, so the body is trying to compensate. And this compensation can be successful to make pH look like normal, or can be just ongoing, so it's still high or still low. Okay, so what are the causes of respiratory acidosis, metabolic acidosis, and others? Okay, mixed. In mixed, as we said, you will find a problem and the compensation to it. That's why you can find pH compensated or going to be compensated. Okay, so what can cause respiratory acidosis? Anything will lead to inability to remove carbon dioxide from the lung will lead to respiratory acidosis. So problem in the chest wall, in the lung, in the respiratory center, like sedative or obesity, unable to take a good breath, will lead to accumulation of carbon dioxide. So this is respiratory acidosis. Okay, what will lead to metabolic acidosis? Anything will lead to accumulation of acids in the blood. It will lead to metabolic acidosis. Prolonged exercise will lead to excessive lactic acid. Lack of oxygen, the tissue will act anaerobic glycolysis, so again lactic acid will be produced. Okay, certain medications like aspirin. Aspirin can lead to metabolic acidosis. Low blood glucose, so excessive ketone bodies, again metabolic acidosis. Alcoholism, seizures, liver failure, cancer, kidney disease, and metformin. Metformin lead to lactic acidosis. Okay, what can lead to alkalosis? Respiratory. If the body did excessive respiration to remove carbon dioxide, respiratory alkalosis will happen. Like in lack of oxygen, like high altitude, okay, the person will do excessive tachypnea. Carbon dioxide will be removed. Fever will lead to tachypnea. Lung disease, liver disease, and again salicylate. So salicylate can lead to respiratory alkalosis, and also here, as we said, it can lead to it was here. Metabolic acidosis also. Yes, so it can lead to metabolic acidosis and also respiratory alkalosis. So metabolic acidosis and also respiratory alkalosis. Both of them effective aspirin according to usual dose or toxic dose.